They told us testosterone was dangerous. But what if that fear cost thousands of men the treatment they needed? New study just rewrote the rules on testosterone and heart health. You need to hear this. For years, men and doctors alike have worried that testosterone therapy might increase the risk of heart attacks or strokes. And honestly, who could blame them? Some of the loudest studies in the early 2010s pointed straight to testosterone as a cardiovascular villain. But here's what we're learning now: the science has changed. And one landmark study may have just rewritten the entire story. Hi, I'm Dr. Max, urologist, men's health specialist. And today we're taking a hard look at testosterone therapy, heart risk, and what the TRAVERSE trial means for the future of treatment. Let's go back to the beginning. In 2006, early research from Molly Shores and others revealed something surprising. Men with low testosterone had higher mortality rates, and much of that came from cardiovascular events. In other words, low testosterone wasn't just a quality of life issue. It looked like a health risk. But then, a wave of studies between 2010 and 2014 told a different story. Flawed methodology, small sample sizes, and confusing results led some researchers to claim testosterone therapy actually increased cardiovascular risk. This was enough for the FDA to issue a warning in 2015. They restricted the official use of testosterone to men with certain medical conditions, not age-related low T, and they added a black box warning about potential heart risks. Let's talk about what really changed everything, the TRAVERSE trial. After years of confusion, fear, and mixed messages, this was the study the medical community had been waiting for. Over 5,200 men enrolled, all aged between 45 and 80, all with confirmed low testosterone. And importantly, every one of them had at least one cardiovascular risk factor, the exact group many believed were too risky to treat. These men were randomly assigned to either testosterone therapy or placebo, and they were followed closely, not for a few months, but for almost 3 full years. That's a long, rigorous study in clinical terms. So what did they find? No increase in major cardiovascular events. None. No higher rates of heart attacks. No surge in strokes. No unexpected rise in deaths from cardiovascular causes. And it didn't stop there. They also saw no increase in prostate cancer. No worsening of urinary symptoms, something that's often feared with testosterone use. And no new safety signals that would justify the level of restriction and alarm we've seen over the past decade. In other words, the nightmare scenario didn't happen. The therapy that had been under suspicion for years, it held up. It proved safe in the very population people were most worried about. This wasn't a small study. It wasn't observational. It was randomized, controlled, gold standard evidence. And it changed the conversation. Let's walk through the 4 key changes the FDA just made to testosterone product labels. Because while they didn't lift every restriction, what they did change matters a lot. First, they removed the black box warning language about cardiovascular risk. This is huge. That warning had been on every testosterone product since 2015, based on older studies suggesting testosterone might raise your risk of heart attack or stroke. But now, with better data from the TRAVERSE trial, the FDA no longer sees that as supported by the evidence. So that bold, scary language? Gone. That means fewer barriers for men who might benefit from therapy, especially those who've been hesitant due to heart concerns. Second, the FDA now requires every testosterone product label to include results from the TRAVERSE trial. This was a landmark study, over 5,000 men, followed for almost 3 years. It showed no increased risk of major cardiovascular events for men on testosterone therapy compared to placebo. By putting that data right on the label, doctors and patients get clear, science-backed context when deciding on treatment. No more guessing. No more fear based on outdated info. Third, for any testosterone product that has completed an ambulatory blood pressure monitoring study, also called ABPM, the label must now show exact data on how that product affects blood pressure. Why? Because some forms of testosterone, especially certain gels or injections, may cause a small increase in blood pressure. ABPM gives a detailed, real-world look at how your blood pressure behaves over 24 hours. If that data exists, it needs to be shared, clearly and product-specific. Fourth, for any testosterone product without ABPM data, the label now has to include a general warning that testosterone may raise blood pressure. It's a kind of placeholder, a way to ensure patients and providers still get a heads up, even if the manufacturer hasn't done the blood pressure study yet. The message is simple: testosterone might raise your BP. If you're on it, monitor regularly. If you already have high blood pressure, talk to your doctor before starting. So, what does this all actually mean for men today? It means testosterone therapy is no longer carrying the same fear, stigma, or hesitation it once did. For years, men were told they had to choose, feel better, or stay safe. And many chose to suffer in silence. They avoided treatment, even when they had real symptoms and real need. But the data from the TRAVERSE trial changes that conversation. This wasn't a small study. It was the largest, most rigorous testosterone trial ever done. And it found no increased risk of cardiovascular events. That's huge, because heart health was the #1 concern holding men back from getting help. Now, for the first time, men with low testosterone and existing heart risk factors can have a more balanced, evidence-based discussion with their doctor. They may not have to choose between energy, strength, libido, and long-term safety. We're not saying testosterone is for everyone. It still needs to be prescribed carefully, with proper testing and follow-up. But what we are saying is this: if you've been putting off treatment because you were scared, you may not need to be anymore. The science is catching up, and your options are opening back up. Now, does this mean testosterone is safe for everyone? No. It still requires proper diagnosis, monitoring, and individualized care. The FDA did not reverse its stance on age-related hypogonadism. If you're an otherwise healthy older man with slightly lower testosterone, you're still not in the officially approved treatment group. But the door has opened, especially for men who meet criteria and were held back by fear. Dr. Mohit Khera, a leading voice in the field, points out that this update may allow more men to get treatment without stigma, and more doctors to consider testosterone not just for symptoms, but potentially for long-term health optimization. He also calls for more research, because even though the TRAVERSE trial moved the needle, there are still unanswered questions. First, we still don't know if normalizing testosterone levels can actually lower cardiovascular risk in the long run. The TRAVERSE trial showed that testosterone therapy doesn't increase heart risk. That's huge. But what about the opposite? If we bring low testosterone back to normal, especially in men with high blood pressure, diabetes, or metabolic syndrome, could that reduce heart attacks over 10 or 15 years? That's the next big question. Second, we need to rethink our fear of prostate cancer. For decades, testosterone was basically considered dangerous if you had any risk of prostate issues. But now, we've got consistent safety data showing no increase in prostate cancer rates among men on testosterone therapy. So why are we still treating testosterone like a red flag? Dr. Khera argues it's time for a more balanced view, one that reflects what the science actually says, not just what we've assumed for years. And third, how do we get this therapy to the men who need it, without repeating the mistakes of the past? A decade ago, testosterone was overprescribed. It got trendy. Clinics were handing it out like candy, often without proper testing or follow-up. That led to backlash, tighter rules, stricter labels, and men who genuinely needed help getting turned away. Now we have better data. The challenge is finding that middle ground, where men with real symptoms and low testosterone can access safe, informed treatment, while still keeping standards high. So here's what this all adds up to. The testosterone conversation is evolving. For over a decade, it was dominated by fear of heart attacks, fear of prostate cancer, fear of making the wrong call. And much of that fear came from flawed studies and outdated assumptions. Clinicians pulled back. Patients were left in limbo. And a lot of men who could have benefited from treatment never got it. But that's changing. We now have solid, high-quality data from the TRAVERSE trial, a landmark study that followed thousands of men for nearly 3 years. And the FDA took notice. They've updated the labels. They've removed the old cardiovascular warnings. And they've made room for a more honest, evidence-based discussion. If you're a man dealing with low testosterone and you've also got cardiovascular risk factors, this is your moment to take a fresh look. Not through fear, through facts. And if you're a clinician, it's time to rethink your framework. Stay current. Rely on the latest science, not on headlines from a decade ago. The research keeps evolving, and so should your health choices. Thanks for watching, and I'll be here for the next step.